So in 2002, the Women's Health Initiative released research that they shouldn't have released. And what happened was the original researchers of the Women's Health Initiative didn't know that the results were being put out, and the way that people interpreted the results that they put out wasn't correct. And it was picked up by the media and mass blasted that the risks of hormones were greater than the benefits, but it wasn't right. And even though many articles, research studies, press releases came out after 2002, the damage was already done. And now, here we are 20 years later, people have good intentions and are still believing this outdated research. And actually, when the New York Times released their most shared article in 2023, it was that women had been misled about menopause, and basically, yes, hormone replacement therapy is not the devil. Now, some people are probably not meant to do HRT. Some people don't want to do HRT. That is totally fine. It's just different than what we thought. So it even changed the way I think and feel about it. But we all thought a long time ago that, oh my gosh, it's going to give us cancer. But estrogen is protective. That's the phrase I've been kind of trying to help people understand. It is protective of our hearts, it's protective of our brains, it's protective of our joints. You know that if you have been through menopause, it's protective of your skin and hair. And so if we remember estrogen is protective instead of estrogen causes cancer, it's kind of a different view. It's a different lens. And hormone replacement therapy is an art and a science. So if you have a uterus and you are taking hormone replacement therapy, you would have to take a progesterone pill to be good to your uterus. If your uterus was removed because you had a hysterectomy, you could just have estrogen. And you can do an estrogen patch. And an estrogen patch doesn't increase like blood clots, which is super awesome. And as an ADHD girly, I wouldn't even have to remember, which I think is super magical sounding. But I've taken care of women long enough to know that the ones that desire to do HRT, and when they get on it, it is a game changer. It's like a light has come on inside them. And so watching that also has helped me change my mindset. Now, I'm writing a book on the science of women's health and wellness. I am studying for the North American Menopause Practitioner exam, not so that I can prescribe hormones. Like, I don't even prescribe hormones, nor do I want to, but I am an educator, and I, as a physical therapist, have the luxury of spending an hour one-on-one with women. So while I'm treating women for joint pain and neck pain, and I am helping them with their habits and the biohacks and supplements and sleep and routines, I'm helping them understand, are you in perimenopause? Are you menopause? Are you postmenopause? And I'm constantly screening. And then, you know what? I need you to take those words you say, write them down, and go tell your doctor. And so hormone replacement therapy is something people can try on. I jokingly say it's like you try it on like a hat and you kind of see. But I think it is a lifesaver for a lot of women, because the number one killer of women is cardiovascular disease. And women who do get breast cancer, yes, some women do not make it, but a majority of them survive. And so it's just a whole interesting conversation where we kind of have to change pop culture and the belief system that we had, and we really have to deconstruct it and ask why. And if you would love to know more, there's this phenomenal book called Estrogen Matters, and I wish I would have found it sooner, because it could have saved me a month of research for my book, but it is lovely, and it would answer any questions you have, and I think every woman should really read it. I wish I found it sooner.